Hey, just a quick note for people that are turning 65 or they're leaving their employer coverage. Just a quick note. Make sure if you're leaving your employer coverage and it's after 65, make sure you get a letter of credible coverage from your employer. Credible coverage means that you worked for an employer that had 20 or more employees and their health care is considered by CMS to be credible coverage equal to or better than Medicare with a drug plan. So if you have a drug plan and their coverage and there's more than 20 people, you can work for as long as you want, as long as they allow you to work. That coverage will not, that coverage will equal Medicare, and you won't be forced to buy Medicare or enroll into Medicare, maybe just Part A. Now, once that's done, for those that are just getting to 65 and you're not going to be able to work for the company longer, you want to contact Social Security. They handle your Medicare enrollment. You need to talk about your Social Security, if you're going to take it at this time or you're going to delay it. You also need to know when you want to start your Medicare. Normally you start the month of your birthday, the first of that month. But you do have a few months if you want to take it at a certain time. But talk to a broker like myself. My name is Ron Rivers. My number is 855-503-2128. And we could discuss your particulars and strategize as to when it's best for you to take your Medicare and answer any questions you may have so that you'll have a better understanding of it. But getting your Medicare started, you need to call Social Security. And then also talk about your Part B deductible, because every month you pay Part B premium for your plan. And then that usually comes out of your Social Security check. So you want to discuss with them your options, because if you don't take Social Security and you delay it, you'll be paying out of pocket. You may be paying 3 months at a time, but Social Security can tell you how to do it so that you can only you can pay monthly for that for Part B. But those are the things you need to discuss. Ask any questions as when it comes to Medicare and the different options. Medicare Original, where Medicare pays 80, you pay the 20. You can get a supplement. They also call them Medigap plans. Medigap plans, you pay them every month. They start about $100 to $200 in general, depending on where you live and your zip code. They pay your 20%, so that if you pay the one payment per month, your Medigap is paid, and there's no limit to what they will pay. If Medicare pays, they pay. Second option, which is different, is Medicare Advantage. It's not the same, but it is health coverage, so it's the same in that way, but they do not operate the same. Original Medicare, your doctors decide on your care, and they submit. They submit the care. I'm sorry, I forgot the name, but they submit it, and it's done. Medicare Advantage, you have to submit it, get prior authorizations from the company. They may or may not agree with the decision of the doctor, and they may deny the coverage, or they may go ahead and pay the coverage, pay for the procedure or whatever the doctor suggests. So the big difference between Original Medicare and Medicare Advantage is denial of coverage. Original Medicare, there is no denial of coverage. If it's medically necessary, they pay. 80%, you pay the 20. Supplement pays your 20 if you decide to get it. Very smart idea to get it though. Medicare Advantage, you're not sure what you're going to get, but pretty much if you're healthy, you're going to do okay. If you are not so healthy, that's where the challenge comes into play. But again, every situation is different. But they do have denial of coverage, and you have to get authorizations, and then you have appeals, and it can be a very challenging situation. A lot of doctors do not like that part about Medicare Advantage, and neither do clients. A lot of people have lost their battle with authorizations being denied. So get to a broker, get to an agent, preferably a broker, because a broker, we do all plans. When I do a quote, I quote every company. I'm licensed in most every plan. There are some plans that I'm not licensed, where you can go to CMS portal and get more information. But for the most part, I carry about 5 to 10 plans, and I'm able to quote and enroll your plan preferences and what suits you best based on your needs and based on what you would like to see happen. So again, brokers give you a full picture. Agents usually work with the companies or work with one plan. You want to shop in a smorgasbord. So 855-503-2128, and give us a call. Ron Rivers can help your family manage, review, quote, enroll. If you have problems, if you have to reprice supplements, we can help you with all of that. Give us a call, and if I can't help you, I will definitely be honest and tell you that I can't help you. Take care.